one of the questions that come up from the audience is that, so for cancer bleeding, so you've done the Hemospray and you have a nice frosty looking coating. And so the assumption is that, it'll probably wash off in the next 24 to 48 hours, patients eating food or drinking water. So how might we explain the relative durable effect of this Hemospray treatment if that physical contact and tamponade is gone away? Is there any thoughts? I'm sure you've thought about it. If folks over here have thought about it, any ideas what mechanism might lead to that efficiency? It's an interesting question.
Come on. Yeah, come on, Mo. Imagine this is one of your Viva questions.
Let's go to Mo for this one. That's what fellows are for, right?
That's an interesting question. The answer is I'm not sure. Why?
I'm just a messenger, so no.
But I mean, look. I mean, we know that the powder lasts for 48 hours. Some of these patients may have had a transient ooze, which lasts a couple of days. But in terms of, scientifically, why they would persist, it's difficult to say really. But the bottom line with this is it's effective. And the transfusion requirements in some patients just often drops to 1 or even 0. And they're discharged quite quickly after, is what I would say about that. But scientifically, I'm not sure as to why.
Yeah, that's an honest answer. I think we don't know everything. That's important to state. Our experience, especially in the cancer realm, is smaller than the peptic ulcer disease realm. I can say this, that in our early experience, and we've been at it for 2 to 3 years now, is that we started out with cancer patients, and in the beginning we chose obviously the most difficult patients, and we did go back and retreat. I found that there was a residual product in certain craters in the lesion, and I suspect that there is a degree of adherence to the focal point of bleeding or denuded mucosa or tumor tissue or whatever you may have. And I'm not so sure that the entire product will have washed off. So that's my take on things, but I could be wrong, and we'll see if there's a more scientific take on it down the road.